To understand what a biopsy is, I think we first have to understand what a cancer is. And essentially, it's your normal cells that are behaving abnormally. So it's a cell that's no longer responding to normal control for like growth and division. And so that one abnormal cell multiplies and forms a lump or a mass. And that's essentially what your cancer is. And so the biopsy is basically any procedure where you take a sample of that lump or a mass and look at it under the microscope to see that those cells are abnormal and to make that diagnosis of cancer. And that biopsy could be done in one of several ways. So we could do it where you get a CAT scan or other imaging modality and you locate the lump and you put a needle in it and take some of those cells. Or it might require a surgical procedure where you go to surgery and you're asleep and we take either a part of the lump or take out the whole lump and have it examined under the microscope to make the diagnosis. My patients have had a lot of things that you've heard or you've seen on TV. I think one popular one, especially when it comes to surgery, is that if you expose the cancer to air, then that will cause it to spread. And that is definitely not the case. I think what more likely happens is we do our best ahead of time before you do a surgery to make sure that the cancer hasn't spread, but no imaging modality is perfect. And so sometimes when you take a patient to surgery and you get in there, you realize that despite what the CAT scan showed, the cancer is already spread. So it's not the surgery that made the cancer spread per se. It's not exposing it to air or anything like that. So I think that's a common misconception. I think another thing that we hear sometimes is like if you have a cancer, so a cancer is classified based on where the abnormal cell started. So if it started in the colon, it's a colon cancer. But a colon cancer, for example, can spread to the liver, but that doesn't mean that you have a liver cancer as well. It's still a colon cancer in the liver. I think that's a common misconception that patients have. And based on where the cancer started, that's what determines the treatment you have. It's not all the same. So even though we say chemotherapy, it's not all the same medication that you're getting. It's not the same surgery. It's not the same radiation. It isn't really one size fits all. And so the complications, depending on what specifically you're getting for your specific cancer, are different. So another misconception, if I get chemotherapy, my hair is going to fall out and I'm going to be sick. That's not true for every cancer. So there are some cancers where you get chemotherapy and your hair will be just fine. So it kind of depends on the specific cancer and the specific treatment that you're getting. I think there's so much fear and anxiety, and people spread a lot of things anecdotally. Oh, my cousin had this and this is what happened, but your cousin's situation is unique to your cousin. So it doesn't mean that if you're diagnosed with cancer that the same things are going to apply for you. I think another thing that contributes to anxiety when you're told that you have a cancer diagnosis is us, your doctors and your nurses. We use a lot of words and terms that you don't necessarily know what they mean, and I think it'll be helpful to sort of define some of those. So definitely if you have a cancer diagnosis, you're going to hear about benign versus malignant. So benign is a growth or a mass or a lump that doesn't spread to other tissues, so it doesn't behave like a cancer, whereas malignant is the same essentially as cancer. It's like abnormal cells that have the potential to hurt you or to spread to other tissues and cause damage. So that's one difference. I think another word that we use a lot as doctors that we don't always explain for our patients is metastasis. That's a big word, but all it really means is spread. So if the cancer is spread, that's a metastasis, or it has metastasized. Another term we use a lot is staging, which essentially just means all the testing that we do, whether that's a CAT scan or an MRI, or sometimes it even requires surgery to tell whether or not your cancer has spread. So once you're diagnosed with a cancer, the next step is to tell, is it just in that one spot or has it spread to other organs? And that's what staging does. So I think a lot of times people don't ask their doctors what terms mean, either because they feel like, well, I should know this and I don't want to feel like embarrassed, like maybe I don't understand what's going on with my care. Maybe that's part of it. Some of it too is just like all you've heard is cancer, and after that you haven't heard anything else. So I think it's important for patients when they do go to their doctor's visit to actually have someone with them, a friend or a family member, someone else that's listening and writing down terms, so that even if that first visit everything wasn't clear, at least you have a record of, well, what wasn't clear, what words didn't I understand, and sort of bring them up later and make sure that you really understand what's going on in terms of your diagnosis and what the treatment plan is.